Hey guys, so I have Dr. Seyfried of Boston College and Stephanie Person on with me today. I just want to start by asking you guys a question. So if you were told about the origin of cancer and of treatment options that require minimum costs and that are non-toxic to the patient, what would it take for you to believe that that might be a possibility? I just want to say that I'm very thankful to have this discussion with both of you guys today. And I was hoping we could start off by you guys introducing yourselves, and perhaps we could start with Dr. Seyfried.
Yeah, well, hi, Scott. It's nice to be here. Uh, I'm Tom Seyfried. I'm a professor of biology at Boston College, and we teach undergraduate students and graduate students in biology and in cancer biology.
And Stephanie?
Yes, I am. How do I explain this? I'm of the people. I'm a person who worked with my mother with a cancer therapy through the ketogenic diet years ago, 15 years ago. And eventually, through my own research and working with 6,000 people, I've developed a platform where I can help people through all, not just cancer, but all types of ailments. So that's how I started with my mother, and then it sort of transformed into all types of physical ailments that I coach people on.
Yeah, I have to say Stephanie's my own personal keto coach, and she's been on Dr. Oz, and they've both been on Dr. Berg. I think that's how I discovered both you guys.
Oh, wow.
But Dr. Seyfried, I just want to start by asking you on your ideas on cancer and the origin of cancer, and where are we mistaken in our beliefs on cancer?
Well, I think right now the general view is that cancer is a genetic disease, and that's been solidified in tens of thousands of research papers in the scientific literature, and also on the National Cancer Institute website from the federal government of the National Institutes of Health. So most therapies that are being produced are based on the genetic theory, the somatic mutation theory of cancer. And most of the treatments that are being given to patients in hospitals currently, the so-called standards of care, are based in one way or another on the view that cancer is an extremely complicated disease requiring various kinds of targeted therapies based on some genetic abnormality that these cancer cells might have. This evidence is now accumulating to say that that concept is no longer supported by a significant amount of scientific evidence, indicating that the origin of cancer is due to defects in the energy capability of the cell, basically the mitochondria of the cell. This was originally proposed by Otto Warburg in the 1920s. We in our research here have supported a large amount of what Otto Warburg had originally indicated in the origin of cancer. He was both correct and incorrect on some of his ideas, but I think the main idea, it's a very simple one, is that when the cell cannot generate energy through respiration, it falls back on fermentation, ancient pathway for energy metabolism. And that's what drives the dysregulated growth of the cells. So all cancer cells that we have studied so far, regardless of what the type of tissue or cell, they all ferment. Fermentation is energy without oxygen. So basically, cancer cells are fermenters. And that's once you know that, then it becomes very clear as how to manage the disease. In other words, they can't live without fermentation fuels, and those fuels are very limited, and that's only the sugar glucose and the amino acid glutamine. So, and they can't burn ketones or fatty acids because you need a good mitochondria to do that. So the strategy for managing cancer now becomes very clear. Target their fermentation while moving the body into nutritional ketosis. And this will work on the majority of cancer patients as a non-toxic, parsimonious way to manage the disease. It's just going to take, I don't know how many years it will take for people to come to know this. And that's where we are today.
Dr. Seyfried, I feel like, I've heard you say in interviews before that this movement towards these ideas on cancer aren't going to come from the medical establishment, that they're going to come from perhaps a grassroots movement from the general public. And I think I'll just start by sort of asking, and making a bit of an appeal to authority, because sometimes you need to do that. Aside from Otto Warburg and yourself, is there any research in the literature or any other prominent sort of researchers that you have to back up these claims?
Well, of course there is. I mean, there's a large number of papers indicating that mitochondria are defective in tumor cells. There's, almost everyone knows that the higher the glycolytic, which is a glucose fermentation pathway, the more aggressive the tumor is. So clearly there's a lot of evidence to support this. But at the same time, you have to realize there's, like everything today, there's some misinformation that seems to constantly be present in the papers. See, I work in the world of scientific research. We are judged by the types of papers that we publish in peer-reviewed journals. And there is a lot of, back and forth. There's much dust that has not yet settled. The biggest problem that we see, why many, well, there's two major problems. One, the major problem is a dogmatic ideological dogma that cancer is a genetic disease. And when you have been nurtured in that view, no matter what the evidence that is presented, it cannot be accepted. You'd say scientists should be open-minded. No, they're not. They have been locked into whatever their particular hypothesis or theory that generates their research is just as strong as any dogma, a religious dogma, a political dogma, whatever it is. You don't get people to easily switch from one religion to another. It just does not happen. And in science, there are theories, and those theories are embraced by a lot of people, especially the dogmatic view that cancer is a genetic disease, which is driven by a lot of very powerful interest groups. That's one problem. That's probably the major problem.
If you want to learn how to implement the ketogenic diet and the Press Pulse protocol into your cancer management, just visit school.com/keto for cancer, the new community by our research analyst Johnny Rockermeyer. Within this new community platform, you can connect with other patients and learn from their experiences. You can also just search through the posts other members have already made. You will have access to our classroom section as well, which provides practical advice and tools for the best results. These sections cover all parts of the Press Pulse protocol that you should implement. Starting with the general scientific concepts by Dr. Thomas Seyfried, we will show you how to start the ketogenic diet, including which foods to choose and which to avoid. Additionally, we prepared a list of doctors specialized in metabolic therapy, as well as details about glutamine inhibition and hyperbaric oxygen protocols. So, take a look around at school.com/keto for cancer.
The other problem is in the metabolism field itself, where Otto Warburg had been criticized by many people for his insistence that mitochondria were defective when cancer cells take in oxygen, making them look like they're normal. We and others have clearly shown that oxygen consumption in a tumor cell is not used for ATP synthesis. It's used for reactive oxygen species production, which causes the mutations in the nucleus. A lot of people cannot accept this, yet we have hard evidence, others have hard evidence. So it takes time for the field to come to recognize what is there and what's real and what's not real. What are the misinterpretations? What are the misconceptions? And we're in the process of slowly resolving these issues. We may never be able to resolve the dogmatic issue that cancer is not a genetic disease, despite all the evidence that we have, because there's just some people that refuse to believe that. And what can you do? But I think the grass, as you're right, Scott. I think that the people themselves, who are going to be the major beneficiaries of this new revolution in understanding cancer, they're the ones that are open to this. They're the ones who do not want to be treated with toxic radiation and these horrible poisonous chemicals to manage their disease. So they're listening, and they're listening carefully, and they will put the pressure on the establishments to start making the changes. Because don't forget, the patient is the consumer. The cancer patient is the consumer. If the patient becomes educated and knowledgeable, they will ask very important questions to their caregivers. And the caregivers better know the answers to these questions. Otherwise, they're going to go somewhere else. It's just that simple.
There's just so much that you have to go up against, though, right? I mean, not only in terms of the sort of the medical establishment and in terms of the revenue generation that comes from these their traditional therapies, but also from that sort of dogmatic view of the public. They've been told since birth that cancer is something else, and it's very complicated. And when people get told something so simple like this, that you could treat it in sort of a non-toxic way at very low cost or whatever the treatment options that you mentioned, it almost seems unbelievable. And I've seen this in terms of I had Dr. Natasha McBride on my podcast, and she sort of said something to me. It was just kind of simple. She said, whatever you've been told by the pharmaceutical industry or the medical establishment, it's pretty much the complete opposite in terms of what's best for health outcomes. And I've found this to kind of be true in my case, in terms of my podcast is very much like diet related, and trying to get people off the idea that fat is bad for them. And ketogenic diets are going to give them heart disease or cancer. And I mean, this is what we've been told by the medical establishment for so long. And we've seen a push towards their foods in terms of what they own, in terms of our agriculture, their processed foods that they're putting on the grocery shelves and everything, and so on and so forth. So there's just so much to go up against. And I think that my view on it is, if we sort of, take away, what you were just saying there. I mean, me not coming from a scientific background, I can't understand a lot of that lingo. So trying to make this a little bit simpler for people to understand, right? Is there do you see any way of overcoming that?
Well, here's the situation. All you have to do is look at the track record of the establishment. We have over 1,600 people a day dying from cancer in this country. And in China, it's over 8,000 a day. Obviously, they have a much larger population. And already in China, cancer has overtaken heart disease as the #1 killer. So we have to look at the track record. Okay, the track record is of the establishment. Let me give you an example with the AIDS epidemic that happened starting in the late 70s, 80s. I mean, AIDS was a death sentence. All of a sudden, the drug cocktail was produced, and death from AIDS was dropped precipitously. That's what I call success. Okay, did they cure it? Maybe not cured it, but they certainly allowed people to live a lot longer with a higher quality of life than was. That shows dramatic effects. The cancer industry is anticipating that cancer is going to continue to rise and rise and rise, overtaking heart disease in the majority of countries in the world. Okay, they are failing miserably in managing this disease. That's obvious. It's obvious. However, with metabolic therapy, and let me say one more thing. We have millions of so-called cancer survivors, just like Stephanie's mother and many others. But many cancer survivors from being treated with the current toxic treatments pay a big price for that. Many survivors pay a big price. They have all kinds of other health issues as the result of surviving very toxic therapies. This can involve neuropsychiatric problems, digestive and hormonal issues, and a variety of other problems, hormonal imbalances, and all these kinds of things. And now they become patients for all kinds of other problems that they did not have, but for the fact that they survived a lot of toxic treatment. You see, we can reduce that significantly, possibly even eliminating. Some of these cancer drugs that we're using could work better and more effectively if the patient were to be in therapeutic ketosis at the time of their treatment. So, I think some pharmaceutical drugs and some people in the establishment might be pleasantly surprised to realize how powerful some of their drugs could be if their patients were placed in therapeutic ketosis before they were initiating their therapeutic interventions. This is another possibility. Then they realize that, wow, if this patient is in therapeutic ketosis when we give this immunotherapy, they do a hell of a lot better and live longer. Eventually, they will come to realize that the metabolic therapy by itself, with drug diet cocktails like we're working on here at Boston College, is going to ultimately replace the majority of therapies that people are currently being treated with. So it's just a matter of time. My group and I understand very clearly what the origin of cancer is, and we understand very clearly what we need to do to manage it. And we keep publishing the papers, and the results come. The more and more patients that survive longer with a higher quality of health, the word gets out. The word gets out and say, I want to do that. I want to do what they're doing there. And then gradually things begin to change. But right now, most people run to their top medical schools, wherever it is, in Texas, California, wherever it is, the top medical schools, and they're not told about any of this stuff. And it's a problem because many of the oncologists themselves have never been introduced into this material. So there's a re-education on the part of both the population and the caregivers that has to take place so we can better manage this disease.
And I want to get into treatment options, how you treat people, and also outcomes. But I just want to shift focus to Stephanie for a few minutes, and I really would like for Stephanie to share her story of her mother's journey with cancer.
Yeah. Okay. So with my mother's situation, she was. I really love Dr. Seyfried's explanation of damage to the cells through fermentation and a lack of or reduced respiration. I think that's what you're talking about. My mom was eating very poorly, so there was no one else in her family lineage that had some kind of brain cancer. But my mother was diagnosed with glioblastoma. When they found her on the floor, a neighbor found her on the floor seizuring. And so they took her into the hospital, and then eventually they found out that she had a very massive growth, a tumor in her brain, a glio. And right there, the outcomes of glioblastomas are pretty dismal in terms of surviving one, especially as one as advanced as she had. But I just remember prior to her diagnosis, me asking her, she was just getting fatter and bigger and more unhealthy. And I just kept saying, how are you? I'm fine. And I'm like, how's your blood pressure? I'm fine. And she kept saying that. I just felt something was going to pop. So I also have been feeling and talking with clients about just things not being connected to some kind of genetic link, but actually the nature versus nurture argument. It's a lot of what people do, if not everything people do to their own bodies. So with my mother, I actually had heard about the ketogenic diet. I don't know how, because this is 15 years ago, and it was unheard of then, very small rumblings of it. So me as the average person, I don't know where I learned it from, but I just put her on some kind of ketogenic therapy at that point. It wasn't a very good one. So people ask what I did to her, and I don't bother telling them because I had her on foods I will not have her on now. And I will not say as to like 1000% I stopped my mother's glio. But my brother and I, we did a bunch of things. We took away her deodorant, her toothpaste, her dishwashing soap, like anything that would be perceived as chemical and toxic, and replaced it with all organic and more natural products, as well as a dietary therapy or protocol. And then also was trying to get her to rest. And my mother would never rest. She was just going, never sleeping, and just trying to change her entire lifestyle. But because of that moment, or that time in my life, I had heard about the ketogenic protocol. Then I just tried to do whatever I could to get her started on whatever I thought was one, and she survived it. She kept going in for MRIs every 2 months, and so that she actually was radiated and given chemotherapy, which aged my mother 50 years overnight. Like, people think my mother looks young now, but I can see the toll, the damage from those toxic chemicals. She really looked young prior to this. And it was very interesting to hear Dr. Seyfried talk about the chemotherapy and radiation protocols, like prior to us going live here, how toxic they are. But even with that, and they did give her a surgery. I mean, it was, I don't know, felt like days it was coming back. The glioma started growing back immediately. So after changing everything in her life and changing the diet, it just stopped. The lesion stopped in her brain. It just stopped. And it's been there ever since. And they stopped giving her MRIs because there was no need to, because it didn't grow. So it didn't continue growing. So that's the story with my mom. I continued to, I did this protocol with my mother because we were saying before, prior to this discussion, this recorded discussion, that it's very difficult to get people to change their diets unless they have a support system. So she had a support system, a huge support system. Both of her kids, my brother and I, were really just on her. And she fought us tooth and nail. In fact, we had to go and throw away a 40-pound bag of sugar because she was baking sweet goods constantly and just eating them. And we got rid of all of it. She really fought that, but she stuck with it, and enough to get the lesion to not continue to grow. And now I can't get her to eat right at all. But at the time, she did listen. And then that turned into me doing it myself and doing this ketogenic protocol. And I did it wrong, clearly, in the very beginning. I was eating a lot of nut butters and coconut oil and cheese, and those things are garbage, in my opinion. Now, after the 15 years, and then from there, actually, I just went on YouTube. I was like, people need to know how important it is to cut out the sugars and processed foods and garbage, and try, especially with people who are dealing with any type of autoimmune or any type of disease or cancer, and cut out these foods and not be so glucose dependent, and try to get into a state of ketosis. And I just started talking about it. I didn't know what I was talking about at the time. I thought I did, but I just was just yakking my head off about it, and people started watching. And then that just grew and grew and grew. Then Jimmy Moore put out a book called Clarity, with a bunch of other doctors. And then from there, it just started growing and growing. And then I started working with people. So I ended up, I've worked with over 6,000 people now. So now over the years, I actually tried the carnivore diet, and but now I see all the different benefits to doing like a low carb, high fat protocol where you're still starch dependent, or doing a very short term, high fat ketogenic carnivore for the short term to take down inflammation. And then for those who don't need to go that extreme and do carnivore, I take people and really put them on a ketogenic omnivorous diet. And I really, really go and see if they're having any type of inflammatory reaction, such as yourself, to some of these foods that are touted as healthy to what we perceive as healthy through, I don't know, how we're raised. And really try to figure out what people are reacting to, because even with plants, some people react very poorly to certain plants, which can obviously wreak havoc on their gut. So that's my story.
Yeah, and she hasn't had a reoccurrence in her cancer in 15 years. So.
No, not at all. I keep thinking it's going to come back, because after probably on the 10th year, my mother got tired of me just nagging her constantly. Like, I just wouldn't accept. And people would say to me, oh, I can't get my parents to eat more healthy. And I'd say, well, you can never give up. You can never give up. Well, now that after 15 years, it's like, she's having PTSD from me nagging her. So it has not come back. It has not returned, but it could. I keep like, what else is going to come back? If not come back, or what else is she going to develop? Because every time I come and visit her, which right now I'm in the process of moving from Texas to Tennessee. So I'm going to go be that militant person back on her and nag again. Now that I'll be living, it's so much easier to help her when I'll be very close to her in the same state rather than California and Tennessee.
Yeah.
But yes, I coached her from another state, and now I'll be that right there with her to try to get her to eat healthy again.
Yeah. Yeah, I've heard many stories like this. I actually read a book by Dr. Boz, so if you guys could check that out, how she helped her mother overcome cancer through ketogenic lifestyle. Dr. Seyfried, I want to get back to you now in terms of treatment options. Say if you yourself were to be diagnosed with cancer today, what route would you take? Does it matter what type of cancer it is in terms of having a therapeutic level of ketosis or glutamine inhibition, or maybe you could just sort of walk through that with us.
Let me just point out a couple of things. Relationship to what Stephanie was sharing with us. I think Kelly Turner wrote a book, Radical Remission. And I think in that book, one of the things that seemed to stand out was radical changes in diet and lifestyle underlying a lot of these radical remissions. And I think what Stephanie did with her mother was a kind of a radical change in diet and lifestyle. And so there is evidence. There is prior evidence for these kinds of. It doesn't happen with everybody, but it certainly has been documented in Kelly Turner's book. So and you're right, Stephanie. It's not clear whether we can consider your mother or whether she is just managed. And I don't like the term we have a cure for cancer, because we never know. We can never know that unless you die in your 90s from something other than cancer, when you had cancer in your 30s. Okay, obviously you were from cancer and you died from something else. But we can never know whether or not we're totally, and that's not the point. The point is, how long can we live with a higher quality of life knowing we've had a diagnosis of cancer? And that, I think, should be the point we strive for. I think, I want to be for cancer. Well, maybe your mother is from cancer, but we won't know that. If she dies at 98 years old from heart disease, then she obviously was glioblastoma.
Right.
So we know that. So I think we have to reevaluate how we consider a long-term survival and quality of life as the result of these kinds of treatments. So if getting back to the question, also I have a commentary coming out in Nature Urology, commenting on two recent papers, again, speaking to what Stephanie was saying, where these were published scientifically documented publications using two different kinds of diet approaches to managing prostate cancer. One was an intermittent fasting kind of an approach, and the other one was a low carbohydrate kind of approach. Both papers, both independent studies, came to a similar conclusion, that the patients that could adhere to these kinds of treatments had a much better outcome than the patients that didn't adhere to these outcomes. So I think we have to be, like you said, Sam, there's a lot of flexibility that we have with using metabolic approaches, dietary metabolic approaches to managing cancer. There's not one rigid approach. And I think the knowledge base of knowing flexibility, knowing what might work better for one patient than another, certainly will move long-term survival and quality of life farther than we can recognize at this point. So ketosis is certainly an underlying therapeutic modality that I think many people will benefit from. And when I say that, all it means is lowering blood sugar levels and elevating ketone levels, because the tumor cells can't survive very well under these kinds of radical changes. And Scott, you asked what I would do if I were to be diagnosed with cancer. Well, the first thing I would do would get my body into nutritional ketosis. That's the first thing. And we now know that various diets can do that. You don't have to go cold turkey, which I mean by just water only fasting. What we see is that when patients, and it's very difficult to go cold turkey. What I mean by that is just, okay, I'm just going to not eat anymore. I'm just going to drink water. Your body really, it's almost like breaking an alcohol or a nicotine addiction. Our brains are so geared for glucose in most of the members of our society that getting off glucose is just as hard as getting off alcohol or nicotine from cigarettes or any other kind of an addictive situation. So you have to break that addiction slowly. In my case, I would go on a low carbohydrate diet for a couple of weeks to get my body prepared and transitioned into this new metabolic state. Once in the new metabolic, and also monitoring blood work very, very carefully. You need to monitor your blood work. You need to know where you are at the time of diagnosis, and you need to follow and see how your lipid markers, vitamin marker, all the different markers are beginning to change. Once the body enters into the state of nutritional ketosis, and we have documented this with our glucose ketone index, which we published to help the cancer patients know when they're in nutritional ketosis. You can buy the equipment, Keto Mojo, a glucose ketone index monitor, and these kinds of things. Once I see that I have a GKI, glucose ketone index, of 2.0 or below, is when I would now begin to take the drugs that I know will work synergistically with the nutritional diet. We use embendazole, some of these parasite medications. We use 6-deoxynoreleucine. I know it's a drug that can be very difficult to get for the majority of people. I know how to get it. I would get it for myself. I would have my friends administer it to me. And I know this because we've done the preclinical work on this. We know how powerful, when you know the types of drugs that work synergistically with the nutritional ketosis, this is the biggest thing. Once you know this, you know what to do. Now, the problem is we're publishing these papers and people say, oh, you did it in a mouse. Listen, it's just as hard to manage cancer in a mouse as it is in a human. People say, oh, and all major drugs that go into human clinical trials have been pre-tested in preclinical model systems. They've been tested. You're not going to just throw something on top of people that has not been evaluated in a preclinical testing situation. So what we do is we know that there are drugs and that work synergistically together with nutritional ketosis, thereby lowering the dosages of the drugs, thereby reducing the toxicity of these drugs, knowing that they will work much better in this new metabolic state. And this is the key. The key is dosage, timing, and scheduling, which we're still working on at this point. So once we have that locked down, so what goes from my lab right into the clinics, because we're working with a lot of physicians. So I pre-test all these things. So we're pretty much on top of what we think is going to work the best. Whether it does or not, we have to have larger patient populations, but we're already seeing in like Stephanie's mother, many, many others, that this stuff really does, these strategies really do work if they're done correctly by knowledgeable people and support groups. I think what Stephanie said is so important. You need to have family support to do this because the type of changes are dramatically different from what other people in the same family might be doing. So it's a team effort, not only on the part of the physicians, but also on part of the family members of the individual that has that particular condition. So but this will all come. Right now, it's like people running around trying to figure out what do you do with this, how much, what should I eat this, can I eat that? It's that kind of a situation. I always tell people, what's your GKI? What's your glucose ketone index? And they say, oh no, it's 15. Well, I said, we'll modify it until you get down to 2.0. Oh, I didn't know I have to do this. Well, and Stephanie and people like Stephanie may be able to modulate these kinds of things to get these people into the correct zone. And then the correct drugs, non-toxic drugs, would be used on this by professionals, of course. You don't do it yourself. I would never do it on myself. that I work with, even though I would tell them what to do and how to do it, and they would do it to me. I'm not doing it myself. But again, you need the professional staff to help you do this. But you need to know what you're doing and why you're doing. And the other thing that I spent a lot of time at the university doing is we teach scientific literacy. The general public is almost scientifically illiterate. They have no clue as to why things work and why things don't work. It's not only the American society, it's many people throughout the world are basically scientifically illiterate. Yet all of the things in our society are driven by science and technology. And we have very little understanding of science and technology. And therefore, patients who really want to survive cancer, it's good for them to gain some level of scientific literacy so they know what they're doing, why they're doing it, and how it's going to work. It's only to their advantage. So this also requires, so you see a lot of changes in a lot of different ways. And there are some people who say, I don't want to know anything about anything. Just give me the pills and the radiation. I'll be fine. Listen, we're never going to take that away. If people want radiation and toxic pills, they'll always be there for those people. But I'm saying that there might be other people who might not want that, and they should also have the option to do that.
Dr. Seyfried, I just want to say, so in terms of the glutamine component of this, which you touched base on briefly there, what would be the treatment option for that? Are there treatment options? I know that you had a drug that you talked about,
Yeah.
which
Well,
I believe wasn't or I believe was rejected. Are there any glutamine blocking drugs out there that are
Yeah, well, of course, there's many. In fact, the pharmaceutical industry is working very, very diligently.
Uh-oh. Sorry, I think we're frozen up here.
For the majority of patients, if that patient is not in therapeutic ketosis. I mean, we've done all these treatments. There's a lot of drugs, like all these immunotherapies that people are talking about that you hear on the news at night, Opdivo, Keytruda, and all those kinds of things. They will work much better if the patients are in therapeutic ketosis. None of the drugs that I see in the pharmaceutical industry being produced are going to work as individual entities. They will help some people for sure. The majority of people will not be helped. And there will be just as, there's going to be many people that are killed by those things, okay, that die quicker. And that's called hyperprogressive disease caused by the very treatment they're using. We want to eliminate that. There's no reason that any human being should be treated with a therapy that's going to kill them faster than the disease does. And yet this happens.
So do you think that those therapies, do you think that they create the fermentation that you've been talking about?
Well, sometimes they can. Yeah, sometimes they can. Sometimes they create an immune storm, what they call cytokine release syndrome. Yeah, a lot of these kinds of things can happen to different people under different conditions. But the issue is that if you're in nutritional ketosis, a lot of that can be eliminated, and the types of drugs that you use can be used in much lower concentrations. So you actually reduce significantly the level of toxicity when doing these things. So the problem we have in the industry right now is that they say, well, we can't believe it unless you do a double-blind crossover study in a large number of patients. What is that? That's a single drug double-blind crossover. You can't. That's not going to work. That mindset has to be changed completely, because you're doing diet drug cocktails here. And there's no way you can have this guy take that one drug, the other guy take the other drug, the other guy do the diet without the drugs. I mean, this is absurd. What's the bottom line here? The bottom line is, how long can we keep people alive for a longer period of time and a higher quality of life? That's the end point, and I think so the whole concept of clinical trials for cancer has to be done differently. And then we're going to see the real movement. We're going to see the real progress. Once we start to change that. When will that? The patients themselves have to demand this. They have to be demanding of their, and I believe that medical establishment, the physicians, will want to do this, because ultimately their goal is to help people stay alive longer. So it's a variety of different, but it'll happen. It'll happen in the future. These things will come.
Yeah. So Dr. Seyfried, do you see this as there's like in terms of the medical establishment, even if they wanted to treat patients this way, that there's no way that they can because they'd be held liable, and they perhaps like lose their ability to practice? Wouldn't that be a concern on their part?
Well, I mean, they're being held liable already for the toxic treatment they're already giving patients. They got to sign all kinds of paperwork. Some of those drugs are going to kill the patients. I mean, they're already in a liable situation. I mean, and now you're going to do something that's less toxic and more effective, and you're going to worry about the toxicity. What's the difference between you think that ketosis is more toxic than high dose radiation? I mean, let's look at it practically. It makes no sense, right? I'm going to lose my license for treating somebody with a non-toxic therapy, yet I'm not going to lose my license for irradiating and poisoning somebody. Does that make any sense? Of course not. So yeah. I think the whole process has to be reevaluated.
I know Stephanie's not a huge fan of intermittent fasting for her own clients. Maybe not. I don't know if that's relating to cancer or not, but Dr. Seyfried, how important is that component in terms of the sort of longer term fasts and perhaps just achieving nutritional ketosis through dietary measures?
Well, I think this is, again, if you've identified the parameters that are responsible for nutritional ketosis. I mean, if some people want to do this by water-only fasting, or some people want to do it with low carbohydrate dieting, or various other combinations of dieting that can bring them into a state of nutritional ketosis, the body will know. That's the flexibility that I think, I'm not going to tell somebody if they, like Guy Tannenbaum, the guy who managed his cancer with prostate cancer with long-term water-only fasts. I mean, he achieved it that way. Another person said, well, I'm not going to do what he did. I want to use a low carbohydrate diet. Either way, you're still going to get into nutritional ketosis. But I think that should be up to the patient themselves, the individual themselves, however they want to get into that, but not going overboard. Like Stephanie was saying, you've got to be careful that some of these people go overboard and they do it the wrong way, and end up, they could potentially lessen the therapeutic benefit of what they're trying to do by not doing it the right way, or having a professional guidance or a knowledgeable guidance person helping them along this path.
Yeah, I think the reason why I'm so anti-fasting is because everybody does it for weight loss. I've even had cancer patients come to me. They don't do it to suppress the what is it? You call it wait, I took notes earlier on some of these terminologies that you're using. Anyway, none of these people are using it as a anti-cancer preventative measure when they fast. Even when they have cancer, they're still obsessed with their weight. And so therefore they do extreme measures. They don't they're like I said, if you're going to fast, rest. Don't go and try to do a bunch of stuff in the state of fasting, because now you're going to put your body under stress and duress and under the fight or flight system. That's why. But go ahead. Sorry, I didn't mean to interrupt.
I know. I think that's important because I know people who run fasting clinics, and it's rest. You don't want your body to be in a super stressed state while you're trying not to eat, those kind of things. So obviously resting, and we've discussed that in our Press Pulse paper that we published. There's a lot of what we call other therapies that can be added on, massage therapy, music therapy. There's a lot of things that can reduce stress, and stress elevates sugar. Cortisone, corticosteroids go up when you're stressed. So even if you're fasting, you're also not putting your body into the best state of health. But not everyone. I know a lot of people who do water-only fasting for cancer, and they're doing well. But I either know others who don't. So again, you have to have that knowledge base to be flexible, I think. It's not one way or the other. Whichever works best for that patient, using the parameters that you have.
I agree. Like I said, a lot of people do it for weight loss. They're not fasting to get to stop the tumor growth. They're doing it because of their weight. I swear I've dealt with so many people who have different types of cancer, and they're still obsessed with how they look. rather than their own health.
Well, I know that, and I think it's the educational mission that you have to let those people know what's in their best interests if they choose. And again, you're never going to get everybody to be completely compliant, regardless of whatever strategy you're using, whether it's traditional chemotherapy or radiation therapy or metabolic therapy or whatever it is. There's always going to be people that do not comply with what they are being told, regardless of the situation. But most people will. Most people will. If they're told by a knowledgeable person with a lot of experience, they will follow the directions, because ultimately their lives are at risk. I mean, let's be honest.
I never understood why people are so they object so much to using keto as a therapy, and these are sort of more natural therapies, even in conjunction with conventional radiation or chemo, right? My wife is a doctor at a children's hospital, and one of the worst things I could imagine and that I see are these children that are being radiated. Heck, even my neighbor has cancer. And Dr. Seyfried, I'll be honest with you, I'll share your content with them. Typically people don't like to look at studies or the literature so much, but sometimes I'll send YouTube videos and they might watch it for a minute or two and then just kind of brush it aside. It seems like there's like, oh, it's just a bunch of quackery or whatever. But so it breaks my heart, and I know you touched base on how we could potentially overcome that. But in terms of managing infants, you see all these children developing cancer now, and I think the rates have gone up several fold over the recent decades. How would you manage an infant, say a child that's only a year old? How would you manage them? Would you also put them on a sort of a more ketogenic type therapy, or how would you do that?
Yeah, well, I think we're doing that now with young mice, actually looking at how to manage the cancer in a more pediatric environment. In other words, a young environment. We're seeing really, again, it comes down to diet drug combinations, because the cancers are basically the same if it happens in a 1-year-old brain or it happens in a 55-year-old brain. Obviously, the microenvironment of the tumor cells is different in the two brains, or in the livers or the bloodstream or whatever tissue happens to be involved. But the basic shortcoming of the tumor cell being dependent on fermentation is the same. The local environment can be different, obviously, from the age of the individual. And younger people seem to tolerate some of these toxic treatments better than older people do. I mean, this is because the body is in a much higher state of readiness and metabolic efficiency, I would say, in the young. Obviously, everything works better in the younger, and they tend to live longer despite these toxic treatments. But they, again, like everyone else, they pay a price for this. The issue here is, once you understand that cancer is a metabolic disease, then it's dependent on the professionals in those areas to recognize this and begin to modify their therapeutic treatments in light of this new knowledge. And this will then eventually change how we treat cancer, whether it's in a child or in a senior citizen. The recognition, and this is the new recognition, that what the fundamental problem is in the tumor cell. Now you just simply adjust the treatments based on the age of the individual. So, and obviously certain things can be done in children that cannot be done in adults, and vice versa. So those things will become to known and modified as more and more people come to realize what the nature of the disease actually is. And I think those are the modifications that will eventually be apparent.
What about outcomes? Like, what are you seeing? I know you're not involved in the medical treatment of these patients yourself, but are you seeing certain types of prognosis or outcome that in terms of success rates or?
Well, I think you can see from Stephanie's story with her mother. I mean, we're beginning to see more and more of these kinds of outcomes, whether it was from lung cancer or breast cancer or bladder cancer or colon cancer. I think the outcomes are like, whoa, I'm still alive. How can I be alive feeling so good if I had stage 4 cancer? We're beginning to see more and more of these outcomes, but then they'll say, well, we don't believe it because there's been no double-blind crossover clinical trial to validate what you're saying. And the issue is you can't do a double-blind crossover to validate this. So what do you have? All of these anecdotal case reports that come, more and more case reports, anecdotal observations. I mean, I publish these case reports. Okay, I work with physicians to publish these case reports. And well, it's only an N of 1. And I said, if you threw 100 people out of an airplane without a parachute, and you put a parachute on one guy, an N of 1, and he survives, what do we have to do? A double-blind crossover on something like that? No, so I think it's just a matter of seeing more and more success stories. Now, Stephanie relates her success story, but there are many like this, but that have not yet been published in the scientific literature. And I think we need to publish these. But I have to be honest with you, writing a human published scientific report, I mean, I have to spend a lot more time on a human case report than I do on the big preclinical studies that we do, because of all the variables that humans do. They're not as compliant as the mice that we work with. The mice have no choice. Everything is regimented, everything is measured, everything is delivered at the same time. With humans, you find out, you say, whoa, this guy is in tremendous management. All of a sudden, his blood sugar goes off the roof. And he said, oh, what did you do? Oh, I went out and had a pizza. Well, okay. But then get back into ketosis as quickly as you possibly can. But, we see this. And I think that to do a large clinical trial on metabolic therapy, I think is going to be quite difficult, mainly because you have a lot of people that don't comply. You have people that don't know what to do, how to do it. So I think small group reports that need to be published, and the general response that people are beginning to see will slowly bring people to the understanding that this works. It can work really, really well, and can work even better than anticipated once we have the knowledge base to support it.
And I think that's also the issue you see with nutrition science, right? It's not like you could lock people in a laboratory and just feed them, right? You're going based on surveys and stuff like that. So is it actually science? Not really, as far as I'm concerned.
Well, no. If you have the right biomarkers, if you know what to measure and how to measure it, you can actually see the progress as the person starts to get healthier and healthier, and the tumor starts to regress. You're linking those changes with clear biomarkers, blood biomarkers, tissue biomarkers, non-invasive imaging. You are using quantitative measures to follow the response of the patient. Also, now Stephanie, obviously her experience with her mother was kind of remarkable that it worked, considering the mother's resistance to the whole thing. But many patients have a sense of empowerment when they know that what they're doing is actually participating in the healing process. This you don't often see in the clinical situation, where the patient is simply administered drugs or radiation or whatever, and they're not really an active participant in the management of their disease. So I think when you do metabolic therapy, the patient actually becomes an active participant.
And so you would say that the success rate is higher from what you've seen than conventional therapies with radiation?
I can't say that right now. We haven't had enough. I would say that if done correctly, under doing the correct measurements and following what we know to be at least the first important stepping stone, I think the outcomes will in fact be better. But for me to go out and say, oh, metabolic therapy will outperform any of the traditional standards of care, I think that's possible if it's done correctly under the appropriate guidelines with measurements that need to be taken. Let's compare and contrast. So for example, for glioblastoma, which we just discussed, we have historical controls, right? The median survival for glioblastoma is 15 months. Median survival is 15 months, right? Many people die within 9 months. All right. So if we have patients that do metabolic therapy and the average survival is 25 months, then we have made a significant advance in improving that disease. You don't need to do double-blind crossover. Advanced lung cancer, stage 4 lung cancer, has a very poor long-term survival, about, I don't know, 10 or 12 months. Okay, if we do metabolic therapy and those people are living 20, 30 months, that's a major success. So we already have the capability of knowing how to do this relative to historic controls. So I think once we recognize this, we'll be able to move the field forward.
And you don't see any forms of cancer that don't respond to this type of metabolic therapy?
Well, sometimes if the patient has been treated so aggressively with very toxic therapies, it's not easy sometimes for metabolic therapy to reverse all of this damage. I mean, you're trying to manage an out of control cancer in a body that's been brutalized by toxic treatments. And I think that becomes a real challenge because many patients tell me, or my colleagues, they say, well, the physician said there's nothing more we can do. Well, what does that mean? Nothing more you can do. Well, we've done radiation, we've done chemo, we've done immunotherapy, CAR-T immunotherapy, we've done every kind of a therapy, and your cancer is not responding. Therefore, there's nothing more we can do. And this poor person now is one step from hospice. And it's very hard to interject now with a metabolic therapy to try to not only manage the cancer, but correct all the damage to the body that's been done by the toxic treatments. So I would say that you need to upfront this. Metabolic therapy should be done as the first course of action on anybody that's I don't want to say everybody, but certainly the majority of people diagnosed with cancer, the first thing they should do is get themselves into therapeutic ketosis if it's possible, under the guidance of a professional. And then they can weigh their options after this.
So Dr. Seyfried, you've been at Boston College for how long now?
37 years.
37 years. Okay. And you have no plans on stopping anytime soon, it seems. What's on the horizon for you in the future? And where do you see this going with with your theory on metabolic therapy in terms of?
Well, I think we have to, there's a lot of things that should be done. You have to document the response of the tumor cells to these kinds of treatments in quantitative measures. We have to show that can we find a particular type of cancer that does not respond to metabolic therapy. So we haven't found that yet. So and when people in the literature say, oh, this tumor is not responding to ketogenic diet, the issue is that they target the glutamine at the same time they use that. Oftentimes that's not, they never even think about that. So you have to find a cancer that can survive a comprehensive targeting of glucose and glutamine simultaneously while under the state of therapeutic ketosis. We have not found that yet. Now, that's not to say that we will never find a particular type of tumor that can withstand glucose and glutamine targeting while in therapeutic ketosis. Well, I'm not saying we can't find that. There will be possibly a type of cancer in a rare type or some sort of type that will do that. We haven't found that yet. So our preclinical studies are looking for that. Our preclinical studies are trying to find any tumor cell that can survive in the absence of glucose and glutamine and the presence of ketones. We have not found that yet. I'm not saying we can't find that. I'm just saying we haven't found it yet. And we need to document that. We have to show that, there's no tumor cell that we looked at that can survive under these conditions. If that's the case, then you have a clear path to managing cancer because you know what their vulnerability is. And it takes a lot of work. This is not easy to do. Preclinical studies are labor intensive. They take a lot of time and energy, and they're not cheap. So the cost of doing these kinds of preclinical studies requires significant input for revenue, for the support that we get to do these kinds of things. So it does take time because it's going to be a many-year process to convince all of the skeptics that cancer is simply a metabolic disease that can be managed this way. And you have to provide data and more data and more data and more evidence to support this. And that takes time, energy, and money.
Are you passionate about the groundbreaking and heroic research of Dr. Thomas Seyfried on metabolic therapy and cancer? So are we. That's why we've created something special for you, in collaboration with Johnny Rockermeyer, a German book publisher and translator. Introducing our collection of meticulously crafted books that distill the essence of Dr. Seyfried's work. Dive into the science and discoveries. These summary books are your gateway to understanding the intricate world of metabolic ketogenic therapy in a clear, concise, and engaging way. Whether you're new to the subject or a seasoned enthusiast, our books offer insights that can change your life. Ready to explore this transformative knowledge? Visit our website at www.cancerasametabolicdisease.com to get your copy. You can buy the ebook there directly and the paper book via the provided links. Here's the best part. A portion of every purchase goes directly to support Dr. Thomas Seyfried's groundbreaking research. That's why the direct ebook purchase is the best option to donate as much as possible. You can see all of the donations Mr. Rockermeyer has already made at www.ketoforcancer.net. That's right, when you buy our books, you're not just investing in your own knowledge, you're also contributing to the future of cancer research. Help us make a difference. Together, we can drive change and save lives.
I think a huge problem is that there's just too much revenue at stake there. I think that we'll need those anecdotal stories to pile up, and we'll need a lot of people like Stephanie and cancer survivors to step up and sort of show that this type of therapy works.
Well, it's like you need entrepreneurs. There has to be some way to know. I'm not saying that you shouldn't make money or on these metabolic therapies. I'm just saying that business plan, the business model has not yet been developed to replace revenue generation. So what's in the best interest of the patient? Of course, but revenue generation is also part of the whole thing. And you have to find a way to generate revenue on metabolic therapy to make others feel that they're not going to be. It's not going to be that big of a disruptive technology. It is a disruptive technology. There's no question about it. Any more than electric cars versus gasoline cars. There are disruptive technologies that are part of our forward progress. But there's adaptations to this. And business models will be redesigned around these plans. There'll be re-education. It'll be a very exciting time as we begin to move from one state to another state. But it takes time to do this. My job is simply proving the concept of what the underlying problem is with cancer and the best way to manage it. I'm not in the business of trying to figure out how I'm going to make $1 billion on this. What is that? That's irrelevant. The relevant thing is how long can we keep people with a terminal diagnosis alive? Listen, we're all terminal to one degree or another, right? So we just want to keep. If someone would like to exist on the planet for a little bit longer with a higher quality of life, is there a plan and a path to achieve that? And I say that there is, especially when it comes to cancer.
Yeah. I want to make a bit of an unscripted sales pitch for Stephanie now. Stephanie has been my own personal keto coach in terms of trying to recuperate my own health. So Stephanie, maybe you could sort of give us some of your own information if people are looking to switch over to a ketogenic lifestyle, because I can tell you guys from my experience, it's not always so simple for people to transition over to a keto diet, especially if you've been eating, like I did, like crap for 30 odd years, right? So Stephanie, maybe just give us your information and what's on the horizon for you as well.
Okay, I'm going to make this very brief because I have a client.
Okay.
First of all, I do all three diets, which is low carb, high fat, which still your body is dependent on starches and sugars, just a very low amount of carbohydrate rather than the standard American diet cultural idea of how many carbs and such that someone would eat in a day. Then I do a keto omnivorous diet where they're dependent on being able to get into a state of ketosis by still eating plants, which I think is very important because of the diamine oxidase and methyltransferase enzymes that break down histamine. So the fiber content's very important. I also coach a sort of a high-fat ketogenic carnivore diet for those who are having like an emergency immediate issue with an inflammatory response to something, whether it be a gut issue, a skin issue, any type of histamine allergy symptom issue, and then I'll put them on a short-term therapy. But I think for those who've never done keto before, who are leery and a little bit reserved on trying to go into state of ketosis by cutting out all their starch right away, I would have them eat some rice, some jasmine rice, a bleached rice that doesn't have arsenic in the hull, and very minimal phytic acid in the meat of the rice, or parsnip. These are all low plant toxin types of foods that people can consume if they're still doing a low carb protocol, or sweet potato, which would be the third option, which still has some oxalates in it. But if people are just going straight from eating garbage to trying to clean up their health, and who are afraid to go and just cut out everything due to problems like having hypoglycemia, feeling garbage, feeling tired, can't sleep, constipation. These are some of the keto flu symptoms that people would experience if they just went straight cold from eating carbs to not eating carbs. I can put them on a lower carb, but they're still eating carbs. Their body's still glucose dependent, higher fat diet, but much lower in carbohydrate than what they're used to eating. A diet that would be following a circadian rhythm window to try to stabilize their blood sugar. Unfortunately, I do not put people on any type of fasting regimen unless it's a 24-hour fast, but that's the only thing I trust them on, because humans, unfortunately, indulge too much on everything. And like Dr. Seyfried said, that people should be monitored when they're doing something, because people don't monitor themselves. They just go all in. They don't try to learn. The literacy, as Dr. Seyfried was talking about before, about scientific literacy, people don't try to learn just the most basic of concepts on how the body works. It's so easy. I'm not a doctor, but yet just because I put a little bit of time into it, I was able to help my mother, help myself, and now at this point, help thousands of people. Just paying attention to the little minute details of somebody's character, how they live their life, trauma, eating habits, people's laziness or lack of information. If you pay attention to those personality types, fear, consume too much what the mainstream is telling you to do, which is not more broad-based and knowledge on just something as simple as all our fruits and vegetables have been genetically altered and hybridized, selectively bred to be something that is Frankensteined out. What does that, beyond the chemical exposure of pesticides and heavy metals in the air and eating plastic and whatever, and having high blood sugar? I just try to talk to people and explain to them, simplify food as we're still mammals. We're still, we have all these incredible sensory to survive. I've got horses. I sit and watch them. I'm like, oh, it's raining. They need shelter. Oh, it's cold. I need to go put a blanket on them. I mean, I think it's called anthropomorphizing. You put your human emotions on the animals. So I still try to get people to understand that we are much tougher and more resilient than we think that we are if we get away from the comforts of life. It's the comforts that jack us up. It's the real true grit of being a human that makes us feel like we have something to live forward in the future, right? To have purpose. And eating quick garbage food is not the answer. And if you want to change your health, if you've got any autoimmune disorder, any gut issues, or any cancer, or it could be potentially leading down the road to cancer, which I think a lot of people are, I think it's going to explode, even more so, is just to explain to people, we are still animals, okay? Looking at your screens before you go to bed, having screens on constantly, not moving your body, which our bodies are meant to be constantly in motion, changing your attitude towards yourself. It's once you talk to people on a humanistic level, they do tend to respond. I say to people, I know I'm going to say stuff you don't want to hear, but I'm trying to leave a tattoo memory, because you may not like what I'm saying now, but in 5 years from now, you'll remember me. You won't remember all those other people telling you what you want to hear, but you'll remember something that I'm telling you, because it goes beyond what you've been taught in the typical world. And I try to explain to people, the body is not that complicated, but it might seem complicated in the very, very beginning. I used to be a pro skateboarder. And in the beginning, they thought it was so difficult to drop into a big ramp. It's not difficult. It's not difficult at all. It's not even difficult to do a pull-up on a pull-up bar. Once you understand the mechanics on how to do it, it's easy. Once you've learned something simple, like a recipe on how to make a cake, then you just keep using that recipe to survive. we are animals and we need to survive. So I try to explain to people, connect with them on a human level beyond, what diet's going to work best for them. I definitely feel that there is no one diet because it just depends on people's ability to adhere to something or comprehend something. So I cover all 3 diets now. I don't just cover ketogenic diets anymore because I realize that probably 5% of my clients actually stick to even trying to do a high fat, no starch, sugar ketogenic diet. And on that note, you can find me at stephanieperson.com, where I have a course that covers all 3 diets. And I do consultations, and been coaching people for the last 13 years and 6,000 deep. And I just keep learning from each individual. That's my that's my research, is the actual people. That's my education.
Thank you so much. I just want to say that you guys are both personal heroes of mine. It's not just because of the wealth of knowledge and research that you guys have done, but also because you guys are honest people, and it's not always easy to find that in this world today. And going against some of the great evils that I've come across in my 40 odd years of living in this world. So
especially with you going through so much with your own health. So I agree. But on that note, I actually have to dip out.
Thank you so much, guys. Yeah, I was just wrapping up.
Nice meeting you, Stephanie.
Nice meeting you too.
Yeah, and thank you, Dr. Seyfried.
I would love to talk to Dr. Seyfried myself and go more into, I would love to learn more about the fermentation and respiration and the non-genetic component to cancer. I want to go to the deep dive, but on another talk, if you would like to at some point.
Yeah, send me your email. I can send you our papers. And
that would be awesome.
And then you can read them. And if you have any questions, you can always ask me, and I'll be happy to try to clear up any difficulty you might have at all.
Awesome.
Okay.
Great. Okay.
Thanks
guys.
so much, guys.
Yeah. Bye.